Good morning, students. Today we are going to discuss the radius bone. This is the long bone which is placed laterally in the forearm. It is placed vertically in our body. Now, before doing the side determination of the bone, we should know the parts. It has upper end. Upper end has a head which is cap-like. Then it has a shaft. Now this shaft is concave anteriorly and convex laterally, and it has lower expanded portion. Now keeping in all these points in mind, now we can do the side determination. Head is directed upwards. Below the head there is an elevation which is known as the radial tuberosity, which should face medially, and this convex lateral border is facing laterally, and anteriorly this shaft is concave. Now so this is the bone of right side. You can see this is the bone of right side. Now we will discuss the bone in detail now. It has an upper end, as I have told you. Now what are the different parts of upper end? It has head which is disc shaped, covered by the hyaline cartilage. It has superior surface, you can see, which is concave, which is going to articulate with the capitulum of the humerus. Now it has a circumference, you can see here. This circumference is covered by the annular ligament, and the medial portion of the circumference is articulating with the ulna bone, that is radial notch which is present on the ulna, and it is covered by the annular ligament. So these structures, they form the superior radioulnar joint. And next to this head portion, the constricted portion is known as neck, which is covered by the lower part of the annular ligament. Below this neck, there is an elevation which is known as the radial tuberosity. Now this radial tuberosity is rough posteriorly. You can see it is rough posteriorly, and anteriorly it is smooth. Now coming to the shaft portion. Now shaft has three borders and three surfaces. What are the three borders? It has anterior border, it has medial border, and it has lateral posterior border. Now this anterior border, you can see it is starting from the radial tuberosity. It is running obliquely towards the lateral side, then running vertically downward, and it is forming the lateral border of the lower anterior smooth portion. So this is the anterior border, which is oblique in the upper part. Now this anterior border, exactly opposite to this anterior border, is the posterior border, which is the mirror image of this. Now again it is starting from the radial tuberosity. It is starting from the radial tuberosity. It is oblique in the upper portion, and in the lower part it is running in the center of the shaft. So this is the posterior border. You can see this is the posterior border. Now it has medial border. Now this is the medial border. It is the sharpest border. It is also called as the interosseous border. Again it is starting from the radial tuberosity. It is coming downward, and it is forming the posterior wall or posterior border of this notch. What is this notch? Ulnar notch. So head of the ulna is going to articulate here. So these are the three borders. The upper end of these three borders is from the radial tuberosity. Anterior border and posterior border, in the upper portion they are oblique, and they are called as anterior oblique line and posterior oblique line respectively. Now this medial border is the sharpest one, which is called as interosseous border. Now between these borders, that is between medial border and the anterior border, this is the anterior surface of the radius. Between the anterior border and the posterior border, this is the lateral surface. So this is the lateral surface. And behind it, between the posterior border and the medial border, this is the posterior surface. So it has three surfaces: anterior surface, posterior surface, and lateral surface. And it has three borders: anterior border, posterior border, and medial border. Now coming to the lower end. This is the lower end of the radius. It has five surfaces. It has anterior surface, which is ridge-like, and this is the point where the anterior ligament of the wrist joint is attached, and radial artery is palpated against this part of the bone. Now it has posterior surface. You can see the different grooves. This posterior surface is bearing the 4 grooves for extensor tendons. And in the center, you can see a tubercle. This is known as the tubercle of Lister, and this tubercle of Lister is present lateral to this groove. What is this groove? This groove is for extensor pollicis longus muscle. Now it has anterior surface, it has posterior surface, and margin of the posterior surface is giving attachment to the posterior ligament of the wrist joint. Now coming to the lateral surface. So this is the lateral surface which is projecting beyond the rest of the bone as a projection which is known as the styloid process. Now it has medial surface. This medial surface, it bears a facet. This is known as the ulnar notch because head of the ulna is going to articulate here. Now fifth surface is the inferior surface. Now if we see closely, this inferior surface has a triangular facet and quadrangular facet on this medial side. So lateral triangular facet, it articulate with the scaphoid bone, and quadrangular facet, it articulate with the lunate bone, which contribute to the wrist joint. Now coming after the discussion of the different parts of the bone, now coming to the different important attachments of the bone, starting from this radial tuberosity. As I have told you, it has rough posterior part and anterior smooth part. This rough posterior part is giving attachment to the tendon of bicep, and this smooth part is related to the bursa of the tendon. Now coming to the anterior surface. Now anterior surface, as I have told you, it has an oblique line. You can see here, it has an oblique line. This oblique line is giving origin to the flexor digitorum superficialis muscle, and below this, the anterior surface is giving origin to the flexor pollicis longus muscle. And below this smooth portion in the lower part of the shaft is receiving the insertion of pronator quadratus muscle. So on the lateral surface, we have the insertion of 3 muscles. In the upper 1/3, supinator. In the middle 1/3, it is the pronator teres muscle, and in the lower 1/3, above the styloid process, here it is receiving the insertion of brachioradialis muscle. Now coming to the posterior side. Now this posterior side has an oblique ridge. In the upper portion, it is giving origin to the abductor pollicis longus muscle. So origin of abductor pollicis longus muscle, and below this it is giving origin to the extensor pollicis brevis muscle. So these are the important muscles which are attached to this bone. Now coming to the ossification of the bone. This bone ossifies from the 1 primary center and 2 secondary center. Primary center is for the shaft, that is, it is appearing by the age of 8th week of intrauterine life, and center for the lower end, it is arising or it is appearing by the age of 1 year and fuses with the shaft by the age of 20 years. For the upper end, the center is appearing at the age of 4 year and fuses with the shaft by the age of 18 year. So lower end of the radius is the growing end of the bone. So this is all about the radius. What is important is that it is the lateral bone of the forearm which is placed vertically in the body. It has upper end, lower end and different borders of the shaft, and important insertions are of bicep tendon, of the supinator, then pronator teres and brachioradialis on the lateral surface, and on the anterior and posterior surface the origin of the muscles of the forearm is there. From the anterior surface, the 2 flexors are arising, that is from the oblique line flexor digitorum superficialis and below flexor pollicis longus. And on the posterior side, the muscles of thumb, they are arising from the upper portion abductor pollicis longus and from the below extensor pollicis brevis muscle. So this is all about the radius. Student, if you like my videos, then it's my request to you to kindly like it, share it and subscribe it. And if any doubt or any query is there in your mind, you are free to ask me in your comment box. Thank you.